any regular listener to this program, a regular reader of my work, will know that my personal opinion of the healthcare system, so-called, in this country is that it is not very good, to say the least. And my next guest, who's returning to the program, she's been on before, is an excellent writer on that topic. She's written a couple good new pieces about it. And Natalie Shure's writing has appeared in the American Prospect, in Slate, and Jacobin, and elsewhere. She is also the head researcher for a television program called Adam Ruins Everything on True TV, and she rejoins us now. So, Natalie, first of all, thanks for coming back on the program.
Thank you so much for having me.
It's always a pleasure. And secondly, I mentioned in the introduction, you wrote a couple pieces I thought were really strong, and that's not any criticism of anything else you might have written. I just thought these ones were good. The first one, you wrote a piece for Jacobin on Bidencare, and it was given the headline, I know we don't always write our own headlines, but Bidencare is a scam. And reading the piece itself, that's an assessment you document pretty well, I would say. But let's start with this, if you don't mind, on Bidencare, so-called, which is Joe Biden's health plan. First of all, he's been promoting it in an odd way, I would say, with a kind of counter sell against Medicare for all, rather than I have a great plan that works even better than Medicare for all would work for you. The framing for the plan that you analyze, the political framing so far has been, Medicare for all is a bad idea, and I don't believe in it. And a lot of misinformation that he's put out about Medicare for all. So it's been, even though, we all expected him to run as kind of affable Unity Joe, he's been coming at, I think, this healthcare question in a very kind of divisive way. And now he says he's going to be scrappy in the next presidential debate. So before we get into the plan itself, do you agree with my analysis of it? And did it surprise you?
Yeah, I think the healthcare sound bites that we've heard from Biden this week track fairly well with the rest of his candidacy, which is that I think that he's making a bet against the left. He is guessing that the center is the sweet spot to be this election. I think he's probably trying to peel off some Republicans who have had enough, who are getting sick of Trump. And of course, maybe people who didn't vote, or, certainly people who voted for Democrats last election. And so I think that to do that, he kind of has to lambast the left a little bit. And he has to lambast Sanders' signature piece of legislation, Medicare for All. What I do think is heartening, if you'd like a more positive spin on this, I think, around a decade ago, when they were all deliberated, or more than a decade ago at this point, when the Affordable Care Act was being deliberated, Joe Biden was really warning against it. He was telling President Obama that this wasn't the right thing to spend political energy on, that it would never work. And now he is, pushing not only to maintain the Affordable Care Act, but, essentially to come out with a public option plan. So the fact that that is the most moderate position in the Democratic field right now, compared to, how things have been for the past couple of years, I would say that that's, a heartening development. It's still not enough, but that definitely suggests that the left flank of the party and Medicare for All are very powerful and very attractive ideas, and that the rest of the party is better off for it, even if Bidencare is nowhere near what we need.
Well, I think that's a great interpretation, and you're right, it is more positive than mine. So let's talk for a second about what exactly Joe Biden is offering. You call it a marginal improvement upon the Affordable Care Act, public option, what else?
So it does a few things. It creates a public option, which, the effectiveness of a public option depends largely on how specifically it's structured. So it's difficult to say how transformative his specific version of the public option would be. But something else that he does that is significant is that he allows free public option plans to people who would have qualified for the Medicaid expansion but are in non-expansion states. So that really will make a huge difference for some of the poorest people and most vulnerable people in our healthcare system. The other thing that it does is right now on the exchanges through the Affordable Care Act, subsidies to help with premiums are capped at around 400% of the federal poverty level, which for a single person is an income of right around $50,000. And so some of the most astronomical premiums that we've seen over the past couple of years are for those people because they're paying absolutely full freight of these astronomical premiums set out by these companies. And so now there is no cap. So if someone's making $80,000 and they're buying a health plan on the state exchanges, they're still only going to have their, premiums capped at, 9% or whatever it is of income, just like someone with less income has. So those are both nice things. Those are things that we'd like to see in a healthcare system. Those are also problems that don't exist under single payer.
Well, when I was thinking about it, and I may yet do it, about writing about some of the alternative plans, and Biden's hadn't come out yet, but what it occurred to me to say about them, and I love your thoughts about it, is for all of these marginal improvements, and they're not nothing, they have, as you say, they do make a bad situation a little bit less bad, but it strikes me that they're all designed to fail. And by that, I mean that you just simply, I used to have this argument with policymakers here in Washington, you simply don't, if you think you can sell a plan that has a $5,000 deductible or costs the average family, a maximum of $10,000, $15,000 a year, in a country where 70% of the people say they don't have $1,000 readily at hand for emergencies, then you've created a plan that's designed to be inadequate for at least 70% of the population. Therefore, it's not protection, it's not insurance, it's a stopgap, it's a Band-Aid on a chest wound, and I feel as if the Biden plan just continues that. And I also feel that anyone who thinks that a family making of four trying to get by in Staten Island or whatever, that's making $80,000 can afford $8,000 in premiums plus copays and deductibles, or someone making $50,000 can afford $5,000. It just strikes me that that's the math of people who are too isolated from the real world. But I'd like your thoughts.
Yeah, I mean, I completely agree. I think that one problem with the way that the center and certainly the right talks about insurance in this country is, as if it's a binary. You either have insurance or you don't, and you're covered or you aren't. And 90% of Americans are covered under the Affordable Care Act. So we just need to, kick this last little thing over the goalpost. I started a sports metaphor that I had no business finishing. So probably didn't phrase that right, but we know that it's really more of a gradation that, a lot of people do have coverage where if you are hit by a bus and incur, 80,000 in medical bills at one time, which certainly happens, those are really difficult situations, then yes, you will be financially protected from a single healthcare episode. But for a lot more people, it really prevents them from getting into the healthcare system. We know that, high deductibles and copays make people use less care, and that they don't necessarily discern between necessary and unnecessary care. People put off treatment for breast cancer, as a new study showed. And so we know that all sorts of things happen. And you are right that the amount of cost sharing in these plans, the amount of the premiums plus the deductibles, are astronomical for most families. And they're just not reasonable things to expect people to be able to pay without flinching. And, frankly, having cost sharing, having high levels of, deductibles and copays, basically redistributes healthcare costs onto people who use healthcare. So it's basically just a tax on the sick. It's a tax on reproductive age women. And I don't think that that's how we should fund a healthcare system that is a service that we want everybody to be able to use when they need it.
Yeah, I mean, I've used the example before, but I had, minor surgery last year, and nobody could tell me how much. My insurance company's website said, ask your doctor how much this was going to cost. Like my doctor had any idea. The doctor's office said, ask the hospital. The hospital said, long story short, $4,000. I mean, that's with quote unquote good insurance. So your point about the binary is well taken. I think the summary then of the Bidencare proposal is not as bad as things were, a happy indicator of the moving Overton window of the political debate among Democrats, but not that great. And kind of maybe that title, a scam, is not all that off?
Yeah, I mean, I think a scam is probably a word that's winking a bit because, like I said, it is an improvement on the Affordable Care Act, and as I always emphasize when discussing these things, the Affordable Care Act did a lot of good compared to the nothing that was in its place previously, and so it's really important not to discount that, not to discount the people whose lives were significantly improved and saved by its implementation, and we know that. That's literally speaking. Earlier this week, there was a study that showed that around 15,000 people have died as a result of states blocking the Medicaid expansion. So that means, around 15,000 poor individuals who would have qualified for Medicaid were it not for their Republican governors deciding that, they wanted to stick it to the federal government and not accept it. So, these are real lives, these are real numbers, and that's really important to consider. But yeah, I mean, overall, the reason that the healthcare system is so unjust and unwieldy is because it operates as an unfettered market system. It's a major business, and there's really no blockage on providers being able to unilaterally decide prices. We don't have much of a mechanism to control costs. And so they will keep rising. They will keep hurting people. Insurers will keep pushing those costs onto their patients in any way they can. They will keep narrowing their networks so that people get hit with surprise bills from, doctors who are contracted by hospitals that are in network and, surprise, you got hit by a car and now you've got, $100,000 bill because there was an out of network surgeon or anesthesiologist, things like that. All of those things are a function of the business model. And, Bidencare doesn't fundamentally challenge that business model.
Yeah, I agree with everything you've said. And by the way, I also agree with all the positive things you've said about the ways that the Affordable Care has improved people's lives. And since we won't have time to do your article on the insulin racket, Justice, I just have to ask you this, Natalie, because when I've said that in the past, exactly what you said, which is, I'm a Medicare for all person. I work for Bernie. My cred there should be pretty good. But, when I've made that point, look, it helped some real people with real lives. A lot of times I've gotten ratioed, I guess is the term, pretty hard for it. Does that happen to you? I mean, do you find that sometimes people who want the same things we want, or is it just me? Because that people who want the same things we want sometimes react negatively when that idea comes up, that this kind of program has helped people too?
Yeah, I mean, I've seen it, but I have to say that for the most part, and I spend a lot of time writing about these issues, talking to Medicare for All activists and doctors and nurses and people who are really steeped in this movement. I can't think of too many who, don't feel that way, who don't have good things to say about the Affordable Care Act relative to what we had before it, which was even more abominable. I think that there's a difference, though, acknowledging that and then still acknowledging its flaws. I don't think that harms the Affordable Care Act, or at least, our ability to maintain the Affordable Care Act until we can build something better. So I think that, sometimes the arguments come in bad faith from the other direction. I think, if you're getting ratioed for saying nice things about the Affordable Care Act from, people on the far left who want to blow it up, I have to assume that that's a well-meaning, if misguided, early step of politicization, something like that. I don't think that too many people feel that way.
Yeah, I think you're right too. And when they do feel that way, my reaction is it's the centrists that are trying to create a false binary and a false conflict between Medicare for all and the Affordable Care Act, claiming that they want to, they're trying to make loyal Democrats feel that Medicare for all are traitors to the cause or traitors to the Affordable Care Act, and that it's incumbent upon people like you and me who support Medicare for all to say, no, this is something better, but we recognize what the Affordable Care Act has done that's good, right?
Yeah, and I think that it's also worth noting that in 2017, when the Republicans were trying to repeal and replace Obamacare, Sanders and a lot of his supporters were some of the most outspoken supporters of it. I think that it's very possible to strike that line messaging, talking about how we made these gains, we absolutely have to protect them, we have to protect the patients who benefited from them while also fighting for more. I don't think that that's that difficult to understand and relay, and that's a perfectly acceptable message for us to put forward.
Okay, well, we will leave it there, but I appreciate that. And as always, Natalie Shure, writer and head researcher for Adam Ruins Everything. As always, just thanks for the great writing and thanks for coming on the program.
Thank you so much for having me.
Our pleasure.